how do we unify patient advocate efforts? You know, we need to promote awareness, raise public understanding of this clinical paradigm shift, but cancer research is global in nature. So how do we take the global message on, knowing that the internet allows patients all over the world to read common information, but research doesn't happen in a vacuum. And so the tissue that's collected in Hamburg may have an impact in a cancer center in Rochester.
Those of you who may have seen this current issue of Cancer World will see that I have a very specific perspective on personalized medicine and the use of the term. And it's very interesting for me, my 30 years working in the cancer field, that we're now just starting to use the term personalized medicine, where actually care should always have been personalized. And I was very pleased to hear that today. This thing that we have a misnomer and we have a problem with terms, because of course every patient deserves to have personalized care, and that there are challenges in delivering personalized care for every patient. I was also interested to hear the comment about how it's very important from you, Francesco, how we need to really communicate very clearly about the potential of these incredible scientific advances, which have had a limited impact at present, but potentially could have a huge impact down the road. But one of the things that I think we have missed out in all of this in terms of communication is the power of the media in helping communicate very important messages. Because unfortunately, there is a lot of hype currently about personalized medicine, and that hype is unfortunate in that it is creating these unrealistic expectations on what personalized medicine can deliver currently. And I think, Kathy, you also have really emphasized that point. For the vast majority of patients today, there is not a mutation test and a drug that can be used depending on that test. So when I think we look at advocacy efforts, clearly there are advocacy efforts required in terms of getting the message out about which cancers we're talking about for personalized medicine today, the importance of having a test done by people who know how to do the test, and that accuracy and consistency of results are important. The importance of doing the test when there is a drug actually available, and that's not a reality for many European citizens today, and also citizens globally, if we're looking at the global impact. And also the importance of helping people understand that this personalized drug is not just a complement, but it's part of treatment. And treatment has to be delivered in a multidisciplinary context within properly organized cancer services. Going back to the point I wanted to make about the media earlier on, it is very important advocacy effort to communicate messages to the media about the reality of personalized medicine today and the potential to make sure that the messages that are being conveyed to cancer patients and to the general public are much more accurate, and the expectations that we generate around personalized medicine are much, much clearer. Because if you do read my editorial, I end up in saying that today, the one biggest thing that can deliver improvements in cancer outcomes is that patients get the right treatment from the right people within the context of an organized cancer service. And the right people are competent health professionals. And competent health professionals include molecular pathologists, through radiotherapists, through medical oncologists, surgeons, nurses, and we have to put the patient in the center of everything we're doing, because that is personalized cancer care.
I totally agree with everything you've said. And in fact, I'm doing a presentation tomorrow, and I just wondered if you had, by any chance, seen it before, because I have echoed your words, exactly what you said. However, I feel extremely frustrated. I've just walked out of a press conference where there was an impressive room of media. 4 speakers. I couldn't have put my point over more strongly, more passionately. Jan Geisler informs me, it's already on Twitter. But none of them are really interested in listening to patient advocates. They want news. They want news about scientific research, about what's out there, what's coming. And trying to put your message over in that is very difficult. How do we actually impress on the media that they have to be responsible partners in making a success of personalized medicine? I think that's one of our big topics that we need to discuss.
I think we have to start realizing what factors actually impact on what the media report and start to become much more savvy about it. One of our problems, I think, is none of us were ever trained to work with the media or to understand how the media actually works. So what I think as advocates you could do is start to understand the media a little bit more, cultivate relationships with key journalists. Journalists are interested in talking to patients. They quite like talking to patients. Many journalists do, because they want patient stories. The problem is they want to sensationalize those stories. So your job is to try and help journalists, and many journalists are interested in being helped. One of the biggest problems journalists face is they often don't have access to information.
Right.
And actually, if you see that in the ESMO, in the meeting room, there is a comprehensive pack about cancer, but they also don't have access to somebody to talk to when a story is breaking. And we have 24/7 news at the moment, and it's highly challenging for journalists to do a good job. But if we learn more about their challenges, and if we learn more about how to help them meet their challenges, I think we can help them do a much better job.
I think for the media, unless it has hit them or they are very invested in science, it sort of floats over their head, just like it floats over the head of the majority of the public. And so I do think that if we could begin to find those stories that aren't about sensationalizing a human being, but where we can crystallize it, because they need to be taught. They don't understand. And if they don't understand, they're not going to gravitate to it. It's elusive and it's complicated. Make the stories plausible, tangible, and the media will begin to understand. But now I think there needs to actually be media training for the media so they can understand what's happening in science.
We actually do both. We do training of scientists and we do training of journalists. And we have a Best Cancer Reporter Award where we try and reward excellence in cancer journalism, because there's some journalists out there who do a fantastic job in reporting cancer stories. We need to cultivate relationships with these journalists, give them, I think the message that message you've just conveyed now is so important.
Make it personal.
Make it but also crystallize it. Make it clear. We need to be clearer in conveying our messages to the media, because they don't have a lot of time.
When we talk about media, there is also another problem, because as ESMO, we are a transnational society. And so I can understand that for very rich Western-style countries speaking in English, this can apply better. Although any kind of journalist is always pushed by the publisher or by the editor to find either a scandal or a miracle. But the major problem, if we want to bring a better care in all countries, that is our ambition, more than having rich people in New York being treated better. That is fine, but it's not our goal. Our goal is that a lot of media in different nations they don't care too much about that unless it's, as I said, something very sensational. And maybe we have to do special programs for training the media in this country to bring the problem of healthcare in the right tracks in these countries. Even more important than doing that in the big 5 countries in Europe and US.
The last few years, we've been working with the World Conference of Science Journalists, where we've gone to the conference and we've had journalists from 100 countries worldwide. We were in Qatar last year. We did a huge session on cancer, which was attended by 150 journalists from across the world. I was interviewed from journalists across Africa. You're quite right. Journalists in many of these countries, cancer is low down their priority. We have a very important role to bring cancer up and make it a priority for journalists, but also to work with journalists no matter what country you're in, to help them understand the nature of cancer and to give them opportunities to understand cancer better. It's a very, very important thing. I'm certainly not interested in the US. I live in Lugano. I've lived in Milan for years. I certainly understand the Italian press. I'm very, very interested in seeing every European citizen, because we're talking about Europe today, every European citizen getting personalized care. And I think the media have a role to play in raising awareness about that. And we have a role to play in helping the media do a better job.